Welcome back to Health Freedom. Here's a story I'd like to share with you, and it comes from the BBC, and it's about parents feel misled by ministers over medical cannabis pledge. Um, and I thought this is a really important story to share with you. A high-profile government climb down that legalised a type of cannabis medicine on the NHS 5 years ago misled patients, campaigners say. It was thought the law change would mean the unlicensed drug, which treats a range of conditions, could be freely prescribed by specialist doctors. But fewer than 5 NHS patients have been given the medicine, leaving others to either pay privately or miss out. The government says safety needs to be proven before a wider rollout. Legislation of whole cannabis medicine was hailed as a breakthrough for patients, given either NHS or private specialist doctors the option to prescribe it if they believe their patients would benefit. Medical whole cannabis users, the entire cannabis plant, which includes the compound THC, the part which can make people feel high, but patients are being turned away, say campaigners, because doctors often do not know about the medicine, which is not on the NHS Trust's approved list. Some specialists who do know about it say there is insufficient evidence of the drug's safety and benefits to support prescribing. The drug would need to undergo medical trials before it could be officially licensed, but these are costly and complicated because of the many chemical compounds within the cannabis plant. Campaigners say trials of medicines containing the whole plant cannabis, particularly with the aim of helping children, would be unethical, as some patients would have to come off essential medication to take a placebo. The BBC has been told that when specialist doctors do want to prescribe the unlicensed products, there is no simple way to get funding. They have to ask NHS England to make an exception to pay for individual cases, but they're almost always turned down. It is known that fewer than 5 have been approved. Licensed cannabis drugs do exist for specific conditions, but they do not use the whole plant. For example, one called Epidolex contains another cannabis compound, CBD. It can be prescribed for epilepsy, but does not benefit patients across the spectrum of epilepsy disorders. One lady, I felt like I changed history. uh, The first patient to receive the NHS prescription for medical cannabis was 11-year-old Alfie Dingley, who had severe epilepsy. His mother, Hannah Deacon from Kenilworth in Warwickshire, successfully spearheaded a high-profile campaign which led to the 2018 legislation change. Before then, Alfie travelled to the Netherlands, where whole plant cannabis oil is legal under prescription for medical purposes. Following Hannah's campaign, Alfie's GP was granted a license to prescribe it under direction by a specialist doctor in a process called a shared care agreement. Alfie's mother believes the treatment has been life-changing. He has not had a seizure for 3 years. He gets 13 bottles of Bedrolite on the NHS prescription each month. The cost of would otherwise be £225 per bottle. Hannah says back in 2018, she felt like she had changed history, opening up the treatment to people with a wide range of debilitating conditions, including chronic pain, insomnia, and neurological conditions like Tourette's. But now feels she is only the drug on the NHS because she made a huge fuss in the media. I think they changed the law to take the wind out of my sails because the campaign was very effective, she says. Parents are clamouring. Senior paediatric consultant Dr. David McCormack from King's College Hospital in London says it was disingenuous of the government to suggest in 2018 that the NHS prescribing was ready to take place. Ministers shifted the heat to practitioners like him, he says. Parents were clambering at the door or phoning all the time as they believed we were able to prescribe, and that was not the case. The message went out, doctors can now prescribe cannabis products, and that put us in a difficult position because in truth, we need to apply for that to be approved by NHS England. Pre-2018, the only way patients could get hold of cannabis products and use them medicinally was to buy them illegally in the UK or travel abroad to get them. Now, if the NHS will not pay, they can legally pay for private prescriptions from specialist clinics. There are now 31 private prescribing centres across the UK. These clinics issued more than 140,000 prescriptions between November 2018 and 2022. It is estimated the medical cannabis market will be worth 1 billion in 2024. One private patient is 13-year-old Jasper Salisbury Jones from Brixton in South London, who, like Alfie Dingley, has a rare form of epilepsy. By the time he was 11, he was having about 800 seizures a day, which sounds ridiculous, but that was where we got to, says Jasper's mum. Alice Jones, the doctors did say we were out of options, so the expectations were that eventually a seizure would kill him. Jasper had tried 9 different other medicines, had brain surgery, and had an electrical implant was put in his chest, but nothing would stop the fizz. Then he tried medical cannabis oil, and his mother says his seizures, which once dominated his life, now only occur every few days. It's just jaw dropping, Alice says. For this medication to do this is incredible. Jasper has been unable to get medical cannabis on the NHS. His parents now pay for a private clinic £1,600 for a 6-week supply. That cost is likely to increase as Jasper gets older and bigger. The couple are using their savings to pay for the medication, and Alice has no longer pays into a private pension. Whilst they say it's financially very difficult, she knows they are lucky. We're not choosing between this and another medication or a form of treatment. We're choosing between this and watching my son slowly slip into mental disability and then probably paralysis and death, she explains. But one parent who cannot get an NHS prescription or afford to pay for one privately is Carly Ashton, an ex-social worker from Christchurch in Dorset. Her 2.5-year-old daughter, Esme, has an extremely rare form of epilepsy that affects fewer than 700 children worldwide. Esme has been treated with 15 different drugs and currently spends much of her life sedated. Carly has been warned that if her condition is not brought under control, Esme could die suddenly from a seizure. Ultimately, they could become more violently. They could cause broken bones, multiple hospital admissions. It could cause her to die in her sleep, she explains. She finds the situation very unfair, knowing there are children with the same condition who say they are benefiting from taking a form of medical whole cannabis. They are almost seizure-free or entirely seizure-free. It's given their life back. Esme's being denied that opportunity, she says. Hannah Deacon says she is heartbroken that legislation she fought for has not led to the hoped-for change. I find it shocking that the government has literally just washed their hands of this problem, she says. The Department of Health and Social Care said in a statement, licensed cannabis-based medicines can be funded by the NHS where there is clear evidence of their quality, safety, and effectiveness. It is important to carefully review evidence on unlicensed cannabis-based treatments to ensure they are proved safe and effective before they can be considered for rollout on the NHS more widely. The government also adds that if a funding request for this medicine is not approved by an independent panel of experts, it cannot intervene in that decision. In Scotland, health boards would make the decision on whether to fund a specialist request for a prescription. NHS Wales said where the NHS healthcare professional wishes to prescribe these products, arrangements are in place for the NHS to consider and, where appropriate, meet their costs. Northern Ireland offers advice for NHS patients. The National Institute for Health and Care Excellence guidelines state it is recommended research into the use of unlicensed cannabis medicines for severe treatment resistant epilepsy. The body which is responsible for deciding which drugs and treatments should be available to patients on the NHS said there is insufficient evidence on the medicine's safety and effectiveness to recommend it for whole population of people with the condition. But it added that this situation should not be interpreted by doctors as meaning they were prevented from considering the medicines where clinically appropriate. It says they can prescribe on advice of a specialist in consultation with a patient. And that was from the BBC. Now, what I'd like to say about this is that it's funny how they've got all this research going on with other medicines, and these patients are being prescribed a lot of different types of medicines, which must cost a lot of money, and yet they're funding that, but they won't um, go the full step ahead and start funding more research into how good cannabis is and how it can help all sorts of patients. My mother, in particular, who's got a condition called spondylitis, which is a curvature of the spine, is in severe pain every day. We tried a couple of years ago to try and get her medical cannabis. No way, wasn't allowed to have it. And again, here we are in since 2018, and now it's 2023, 5 years on, and you still can't get it. And I think it's just disgusting. I really do. What do you think? Please put some comments in the comments down below. If you like this video, give it a thumbs up, and if you like the content, there's more live content every Tuesday at 8 p.m. I do a live show, very interactive live show, a bit different, and it's the Health Freedom UK news and chat show. My name's not a Dr. Robert, and thanks for listening, and I'll see you again very, very soon. Bye for now.